Professor Tekyiwaa Manuh
Mm-hmm.
of the Economic Conference of
Economic
Africa,
Commission.
Economic Commission of Africa, Director of the Social Development Policy Division. Thank you very much for joining us.
Thank you.
Um, Let me go straight to the point. I think we have made some progress in recent years with the acceptance of a commitment to establishing a social protection floor. Um, and there is now increasing grudging acceptance that fiscal capacities, even in poor countries, is adequate to provide such a floor. What do you see as the major challenges in terms of the acceptance and the implementation of such a social protection floors, particularly in sub-Saharan Africa?
Yes, thank you very much. I think that the issue about social protection has come a long way from being viewed as a residual category to now being seen as absolutely critical for equitable and sustainable development. At the same time, it seems to me that um, policy discourses among the countries vary, and that whereas there is acceptance at global level, at country level, especially in Africa, it is still treated as a residual category. And what we have are piecemeal efforts at social protection, normally targeted to so-called vulnerable groups. And yet, as has been so well brought out during this conference, when you have more than 70% of populations in many countries who are poor, then it becomes fundamental that you do have um, universal coverage and an extension of social protection to virtually all sectors of the population.
With the low levels of income and the high levels of poverty and in much of sub-Saharan Africa, it is, and also high levels of unemployment, it is very unlikely that we will be able to eradicate poverty as well as hunger within the next 15 years or next 17 years, as both the World Bank and others uh, hope will be the case. Without social protection which will at least ensure a minimal level of decent living. Um, what do you feel would be crucial in terms of ensuring adequate financing for social protection in order for us to overcome poverty, hunger, and food insecurity?
Yes, I think that to ensure adequate financing for social protection in the context of low levels of income and high levels of poverty, states have to rethink. Um, let me reframe it. I think that there's a lot of redistribution that is required. That in most countries there is sufficient money, and of course there is still room for inflows from different sources, but there is sufficient money, but there has to be a real rethink and an effort at redistribution to ensure that those who can pay their way do so. I think that the low levels of corporate taxation is simply shocking given what is extracted from many African countries. Um, the other point, of course, is that the best social protection is ensuring that people have jobs. So it is also important that there is a focus on job creation, that we do not have this growth without employment, that everybody's talking about Africa rising, the resurgence, the optimism, etc. And yet it is not translated into jobs and social protection. So I think that, in terms of financing, we also need to move away from these regressive measures, the kinds of indirect taxes that actually overburden the poor to really designing more robust and progressive taxation systems, which then produce revenue to finance social protection and also protect those who are poor from being overtaxed.
The increased collaboration between the ECA and the FAO can be very important. The FAO has brought two issues to the discussion on social protection which may be of interest. Number one, as you know, 3/4 of poor people are to be found in the countryside, and their incomes and livelihoods depend very much on agriculture, pastoralism, fishing, and so on and so forth. And so rural development, rural poverty, overcoming rural poverty will be very, very crucial in this regard. The second issue is that FAO has been emphasizing, to use the slogan, from protection to production. In other words, not just giving a fish to the recipient for the day, but enabling the recipient to be able to produce the means for their own livelihoods in the future. This emphasis is, I think, quite important now in overcoming the objections. We find that in many developed societies, they are now saying that they have fiscal problems because of the over-expansion of the welfare state. And developing countries should not pursue social protection measures because of this, their experience with the welfare state. How would you address these kinds of issues?
Yes, thank you. I think that in terms of the issues that FAO has brought to the table, you will find complementary issues in the ECA. I think that ECA has been stressing the key messages is about structural transformation in Africa, and based on commodity-based industrialization, which links very much to the agricultural sector, that instead of just carrying cocoa, all of those things, it's about value addition, which of course increases the value of, producers. So in this case, rural producers. So it actually helps to boost the agricultural sector and the incomes of the producers. It also creates jobs along the way in this value addition. And I think that, as I said earlier, the best social protection is a job, which is the same thing about from protection to production. So in that regard, I think that we have very similar messages which would make for very effective collaboration, because we are arguing that we cannot go on as before, that we cannot just be markets for finished products, and that each time we export a bag of cocoa, we are also exporting a lot of jobs, and I think that our economic report for Africa last year on making commodities work for Africa's industrialization was a case in point, and that this would also deal with the issues of high youth unemployment and also much more inclusive development. Yes.
One of your recent initiatives, which is very important and complementary to what we are trying to do in the FAO, is the whole question of working on social protection, particularly in the area of nutrition, because this enables us not only to ensure that people, generally speaking, have enough dietary energy to be able to work and be productive members of society, but also the focus on childhood nutrition is very important in terms of ensuring the realization of full human potential by overcoming stunting, wasting, by ensuring that young children in their first 1,000 or 2,000 days of existence are able to receive the nutrients, including micronutrients, which are so important for cognitive and physical development. So this is a very important initiative, but some of your findings are quite shocking. Would you care to describe the challenge for us, and what you hope to be able to achieve.
Yes, thank you. Well, you're referring to the cost of hunger studies in Africa, which is looking at the social and economic impact of child undernutrition in selected African countries. We completed the studies in 4 countries. They are ongoing in 8 countries now. And as we speak this week, there is a launch of the study in Burkina Faso. The methodology was adapted from Latin America, but then, if you like, it was domesticated to the African situation. And indeed, the findings have been shocking and disturbing that today there are more stunted children in Africa than there were 20 years ago, or that as for the fact that repetitions in school and that stunted children achieve less education, that is not so much of a shock, but that child mortality associated with undernutrition, for instance, has reduced national workforces by 1 to 8%, and also that 40 to 60% of working age populations suffered from stunting as children. In other words, we cannot begin to address issues of productivity without, an understanding of these causes, that people are not just lazy, but that there are physiological causes that they fail to achieve a certain cognitive and developmental level. The fact that annual costs associated with child undernutrition vary from between 1.9 to 16.5 of GDP in the countries that we studied is really very worrying. And therefore, unless we eliminate stunting in Africa, we cannot talk about inclusive development. I think it is broadening the debate. And for us, what it is leading us to, we've just developed this African Social Development Index, where stunting is one of the indicators, of human exclusion. And we are also, which fits in with some of the issues that have come up in this conference. We're just we've just developed a concept note to monitor investments in social protection across Africa, because you go to countries, everybody tells you they are doing A, B, C, D. In the last session that we just had, the gentleman from Uganda was saying that a review of PRSP programs in Uganda and Kenya showed that within one government there could be about 40 projects, with different ministries and agencies, some of which do not even know what the other is doing. So, and also the African Union sees it. We've been working with the African Union and the World Food Programme in this initiative, and they're starting this initiative on eliminating. I think that it's important when we are not content, we just reducing, and at the same time, countries like Tunisia are some of the few countries that actually have managed to reduce stunting in the last few years. So it is possible through concerted effort to do something about it, but to recognize the multifaceted and, if you like, the generational impacts of some of these issues. Yes.
One last question, if I may. One of the biggest problems we face with nutrition governance is the fact that in most governments, nobody feels responsible for nutrition. We know that in many agricultural ministries, the success of agricultural ministry is measured by increase in output and in increase in revenue, increase in exports. There is no measure of success in terms of the improvement of the human condition, of the nutrition condition of the population of the country. Health ministries, the emphasis is on recognizing nutrition problems, but the solutions are often related to providing nutrition supplements. Whereas the kind of approach which we would favor is to try to meet the nutrition requirements of the population through through an improved food system. And this is where the ECA is better positioned to try to develop an all-of-government approach to nutrition rather than a ministerial approach to nutrition. And we hope that this is something which we can work together on. And the interrelationship, for example, between social protection and nutrition are things which obviously you have been thinking about and are doing something about.
Thank you. I think that the issue of nutrition governance is is key, and indeed we reiterate at the end of in terms of policy recommendations from the cost of hunger studies that stunting is a useful indicator to evaluate effective social policies, and also that we recognize stunting as a multi-causal problem that requires a multi-sectoral response. So we're saying that it cannot be attained by the health sector alone. And what is happening in many countries where this study has taken place, Swaziland is a case in point, Ethiopia, Uganda, is that the office of the president has taken charge of coordinating, initiatives in this. I think that many of the countries have been embarrassed by the findings, but what is more important is that they've been challenged to do something about it, and they recognize the multi-sectorality that, as you say, and one of the things that ECA did recently at our annual conference of ministers was to have a presentation in the meeting of experts and also a side event on the cost of hunger in Africa studies, to also bring it to the attention of ministers of finance and planning that this is not an issue only for health ministries or agricultural ministries. And if you begin to cost what it does for productivity, for the workforce, etc., this is an issue that needs to be stamped out. So clearly there is room for collaboration between ECA and FAO in really coming up with a robust governance structure for dealing with nutrition. And we look forward to this collaboration.
Thank you very much, Professor Manuh.
Thank
All
you
the best
very
for
much.
your new responsibilities.
Thank you. Thank you very much.
Thank you. It's 17 minutes for you,
Yes.
right?
So you